Hey everybody, it's the 7th of November and this YouTube video is a follow-up to the one we did about 3 weeks ago in regards to the AT&T retiree healthcare plan that comes to a screeching halt at the end of this year, forcing thousands and thousands of retirees to go out and purchase a Medicare plan. We've been helping a lot of folks here in Kansas City and further afield in Kansas City over the telephone, helping them figure out a plan of attack, how to navigate the Aon exchange, what they need to do, what they don't need to do. So let's get started. Just go over a few of the basics of this. So the first thing we need to know is you only need to purchase one plan through the Aon exchange. And the reason we do that is to unlock the HRA money. That money is provided to you from AT&T as a benefit. And if it's you and your spouse, it's a $4,200 benefit. Whether they continue to provide that year after year is yet to be known. So you only need to purchase one plan to unlock your HRA money. Secondly, you can use your HRA fund to pay for the premiums for both your drug plan, your Medicare supplement plan, and your dental vision plan if you so choose to have one. And lastly, the whole purpose of these videos and helping the folks that we've been helping is to make sure they're getting the best possible price for the Medicare supplement plan of their choice. We find that on the Aon site there are a few choices basically when it comes to Plan G, and that's really the plan that we're recommending that people should try to get. It's not a guaranteed issue plan. You do have to go medical underwriting to get Plan G for most folks. But if you can get it, that's the plan that you want to be on. So for those of you who have gone to the internet and pulled up the Aon website, you'll be familiar with this screenshot. What we're going to do here is take a couple from Kentucky, zip code 41651, male. We want to make sure we're hitting the Medigap tab to see the Medigap plans that are available. And in this instance, we're going to look at Plan G. There are 3 companies listed that sell Plan G. According to the website, but we can only get quotes for 2 of those companies. So there's Transamerica, Loyal American, and Anthem Blue Cross. The highest premium is $221.69, and the lowest premium available is $190.81. So there are dozens and dozens of Medicare supplement companies in that area that provide these plans. Aon happens to show 2 of them, and they're probably most expensive ones. So let's take a female, age 72. She happens to be the spouse. We put in her date of birth, and she's a non-smoker. And let's take a look at the rates. Again, we're going to have 3 companies to look at. Make sure you hit the Medigap plan tab so you're getting all the Medigap policies. We're going to select Plan G. We're going to select all the companies that are available. And again, we can only see 2 companies that are populating a premium. One is $165.82 and the other one is $195.87. Well, you'd ask yourself, why would I pay $195 when I can get it for $165? Well, that's exactly right. Every Medicare supplement plan is exactly the same except for the premium. So what do we have? We have Mr. H. He's 73 years old. On the Aon site, his premium for Plan G is $190.81 monthly. When we go out onto the open marketplace, we can clearly see that the best price for that plan, that exact same plan, $145.67 monthly. That's a total premium savings of $541.68 annually for Mr. H. That's a lot of money, folks. You'd be better off putting that money towards your drugs or towards other healthcare costs or even back into your own back pocket. Let's take a look at Mrs. H. $165 is the rate on Aon, $126.70 on the marketplace through your local Medicare agent. Total savings of $469.44. Combined, that's an annual saving of $1,011.12. No reason to pay that money to Transamerica or Cigna or whoever it was on the Aon website when you can go out into the open marketplace and get these plans cheaper. This is a typical quote engine that we can look at all the plans in the zip code of 41651, Floyd County in Kentucky. Effective date obviously is going to be January 1st. your United Healthcare plan will end on December 31st. And if you have everything set up correctly, your Medicare supplement and drug plan will start on January 1st at midnight. So Forethought, the one in the orange, no longer sells Medicare supplements. They're out of the business, so that's why that's highlighted in orange. But if we look at the next best available plan, it is $146.67. That's for a plan G, $146.67. And that's for the male. Now let's take a look at the female. We look at a plan G. Again, effective date of January 1st, non-smoking. Again, we're looking at a lowest premium rate of $126.70. The top one is Forethought. That company no longer sells Medicare supplements, so the lowest premium is $126.70. We purchased those two plans on the open market. We save ourselves over $1,000 per year just because we went out onto the open marketplace and searched for the plan that we wanted, and we got a lower premium. That's how you do it, folks. We're here to help you. Give us a call at 800-405-4802, 800-405-4802. You can contact us, you can email us, whatever we can do to help you. Let's make this a seamless, easy transition, and don't worry about all the paperwork you're getting from Aon and AT&T. That's more confusing than anything. Just give us a call, let us help you, and we'll get through this together. Thanks and have a great day.